Guys, and welcome back to my YouTube channel, The Facial. Now, so we were discussing about the gastrointestinal motility. We had covered phases of deglutition, movements of stomach, gastric emptying, and moving towards the movement of small intestine. Okay, so what is the movement of small intestine? The various movements of small intestine are mixing movements, propulsive movements, and movements of villi. Again, your mixing movements are divided into segmentation and pendular movements. Okay, segmentation again divided into eccentric and concentric. Segmentation contraction. Okay, these contractions are initiated these contractions are initiated by pacemaker cells present in the duodenum. Okay, pacemaker cells present in the duodenum, they cause development of slow waves, okay, which causes contraction of longitudinal muscle fibers. Eccentric and concentric. Okay, so contraction of outer longitudinal, which causes mixing of chyme, which is localized contractions, is eccentric. Okay, eccentric. Concentric contraction of inner circular, outer longitudinal, inner circular. Trick to remember, alphabetically C comes before E, so C would be inside E. Okay, C and then E, inside, outside. C comes alphabetically before E. So okay, so concentric inner circular muscle fibers contraction, which causes narrowing of lumen, okay, and hence causes churning of food. Eccentric causes localized contractions, and concentric causes your churning of food. Easy. Now moving towards pendular movements. Segmentation movements done. Pendular movements, this type of movement helps in mixing of intestinal content. A long segment, name itself suggests pendular, it is mixing of intestinal contents. A long segment of intestine move over its contents to and fro. Long segment of this is a segment of intestine. It movement, the long segment moves over its contents to and fro to form a pendulum, hence it is called a pendular movement. Easy. Mixing movements done. Now the propulsive movements. Propulsive movements, peristalsis. This is very important. Okay, peristalsis. It can be asked as like a separate short note. Okay, so peristalsis, the presence of food in the intestine causes distension of the intestinal wall. Okay, see, this is the lumen. It is empty, so it won't be distended. But when it is filled with the the food or the chyme, then it would get distended. Okay, now this distension causes the peristalsis. Okay, these are the signals of peristalsis. This causes circular constriction to the proximal of the food and dilation distal to it. Okay, so movement contraction in this phase and dilation in this phase. So this will get dilate, this will contract. Hence the food particle will keep on moving ahead and ahead. Okay, from the esophagus to the rectum. Easy. Movements of villi. Movements of villi are due to alternate contractions and relaxation of muscles present in them. So alternate contraction, relaxation of muscles. Now, a local hormone, villikinin, also plays a role in increasing villi movements. Very important, villikinin. See, villikinin, name itself suggests kinin means kinetic. Kinetic means movement, and villi itself means villi. Okay, of the small intestine. Now, we are done with the movements of small intestine. Now the movements of large intestine are not that important, so we'll be moving towards defecation. Very important and very easy. Defecation is a process by expulsion of fecal material. It involves both reflex and voluntary activity. It is a spinal reflex with the center present in the sacral region. However, it is also influenced by higher center. Easy. Now, internal anal sphincter is involuntary and external anal sphincter is voluntary. Okay, internal involuntary, an eye for an eye, as you say. So internal involuntary. Internal anal sphincter is composed of smooth muscles situated in the pelvic rectal flexure, supplied by the autonomic nervous system. Okay. Now the external anal sphincter is composed of striated muscles. Striated muscles, but it is not voluntary. It is voluntary. Sorry. Okay. It is innervated by the pudendal nerve. This was innervated by the autonomic nervous system. Okay, the innervatory parasympathetic nerves. Now the dribbling of fecal matter is prevented by the tonic contraction of external and internal anal sphincters. Okay, there are tonicity. The tonicity of external and internal anal sphincter maintains your prevents the dribbling of fecal matter. Defecation reflex. Easy. Listen carefully. Entry of fecus into the rectum causes its extinction. We have learned that rectum is the last part of our one of the last parts of our large intestine. So the efferent signals are initiated by the myenteric plexus. Okay, we had two plexus, myenteric and Auerbach. This one is myenteric plexus. The movement of feces towards the anal canal relaxes the internal sphincter. Once the internal sphincter is relaxed, then only the external sphincter is remaining to get relaxed. Now, defecation occurs if the external anal sphincter is also relaxed. Obviously, it's just a general sense. The intrinsic defecation reflex is relatively weak. It is made stronger by the reflexes of the spinal cord. Okay, it is made strong by the reflexes from the spinal cord. Now, Increase in the parasympathetic discharge resulting in increased peristalsis of colon, increased rectal pressure to 55 mmHg. These are all the facts if you want to remember. One thing which is important is in infants the defecation reflex occurs spontaneously. Okay, since they are not voluntarily defecating. Now we are done with the movements of small intestine, movements of defecation reflex and all. Now we'll be moving towards the clinical aspects. First clinical aspect, very important in your clinical medical field, diarrhea. Diarrhea is produced due to rapid movement of the fecal matter through the intestine. Okay, like feces are discharged from bowel frequently, like frequency of your bowel discharge is increased, and the bowel also is in liquid form. Okay, and large quantities of fluid electrolytes are also lost from the body. Now moving towards the megacolon, that is Hirschsprung's disease. It is due to a congenital condition characterized by the absence of intrinsic nerve plexus, that is Orbach plexus, the Orbach one which is between the two muscular legs. Constipation, well known, constipation is the failure of proper evacuation of the bowel. Okay, it results in decreased bowel movements. As we know, the most common cause of constipation is irregular bowel habits. Okay, also the symptoms include anorexia, abdominal discomfort, and distension. What is anorexia? Anorexia is that the fear of being like getting fat and all. Okay, so these were your clinical notes. One more clinical note, very important, is the vomiting. Now we have came towards the last topic of our discussing of the gastrointestinal motility, which had 6 topics which were very important from your university question point of view. Okay, the last topic, vomiting. It can also come as a short note, but I think it's better if you write it with the gastric emptying and all, because it is a clinical point of that only, clinical aspect of that. What is vomiting? Vomiting is a process by which the upper GI tract empties its content. Remember, upper GI tract, not the whole GI tract. Why? Because only the upper 2/3 is of the esophagus is voluntary, and lower 1/3 is not voluntary. Okay, so empties its contents when it is excessively irritated or over distended. The process of vomiting occurs by antiperistalsis. Very very important again. Okay, antiperistalsis. So this is our pathway for vomiting reflex. Have a look at it once. Now, it is usually preceded by the associated features such as nausea, dizziness, tachycardia, swelling. Also, you can feel like your mouth getting filled with saliva, like the salivation increases. Okay. Now, the afferent impulses are transmitted by both sympathetic and parasympathetic. Afferent impulses from the vestibular nuclei are responsible for initiating vomiting due to the motion sickness. Mostly, people who like have traveling sickness and on motion sickness, they will undergo vomiting. Vomiting center, very important, can come as MCQ. It is present bilaterally in the medulla. Okay, present bilaterally in the medulla. Medulla is a part of your brainstem. Okay, it lies near the tractus solitarius at the level of dorsal motor nucleus of vagus. Okay, so now gastrectomy. Total gastrectomy is removal of the whole stomach. It leads to various effects that include, predisposition of iron deficiency anemia, dumping syndrome. Okay, and all this. What is dumping syndrome again? It is a condition seen in individuals who have undergone partial or total gastrectomy. This was your chapter. Please give me your valuable feedbacks in the comment box. It's okay if you don't want to subscribe or like my video at this point of time, but you will do it surely in the upcoming video. Okay, but please let me know your feedbacks in the comment box given below the video. Thank you.